These are the months where we typically worry about our children getting sick. Now, because of the pandemic, everything seems a little different this year, but it is still true that RSV season is upon us and we need to take steps to protect ourselves.
Respiratory syncytial virus, or RSV, has been around for a long time. It spreads most commonly between October and April each year and is one of the leading causes for children to be hospitalized for respiratory illness. Symptoms include runny nose, cough, sneezing, and fever, and in more severe cases, wheezing, difficulty breathing, and shortness of breath. RSV can cause cold symptoms in anyone, but kids under the age of 2 are most susceptible.
When young kids get RSV for the first time, they're at higher risk for getting lower respiratory tract infections in addition to the upper respiratory tract infections, and those tend to be a little bit more severe.
So how can you protect your little ones? Doctors recommend keeping your new babies away from other people for the first couple of weeks because a virus that can look like a regular cold for adults can be more severe for infants.
It is okay to be around babies if you're taking the appropriate precautions. Certainly if you're sick, that's a time where we would discourage that from happening.
Something as simple as washing your hands or using hand sanitizer can reduce the risk of transmitting RSV to a baby. It's still too early to know what can happen if you get RSV and COVID at the same time.
Kids under 10 are at less risk for complications from COVID, and they're much more likely to have severe illness from things like RSV or influenza. So making sure that they get their influenza vaccine is still one of the very most important things that parents can do to help keep their kids healthy.
There is no vaccine for RSV, and there aren't any medications to help with treatment aside from oxygen and a ventilator.
Doctors say on a positive note, with social distancing and masking in place, it is likely that RSV cases could be down this year. If you have any questions about the health of your baby or young child, call your pediatrician right away.